dust everything. Because yeah, maybe they cleaned it overnight, but I'm just gonna make sure. So I'm gonna take my Sani cloth wipes and I'm gonna damp dust everything and make sure everything's ready to go, right? So then I'm gonna get my basic pack. I've got my major tray and I've got my basin set, okay? The first thing we do is check the integrity of that package to make sure it's good. Okay, and then this would obviously go in the trash, but we recycle here at Southeastern and we're gonna save it, okay? So, sterile to unsterile, I'm just gonna move this out of the way because I don't want it to be close to my table. And then I'm just gonna kind of take this and open it up without reaching over my table. I don't know that I like this.
Yeah, we did it a different way.
Turn it. Yeah.
Where you pull away from you and then, yeah.
And then I'm gonna take it and right here so that I'm not over my field. And I'm gonna pull this away just like this and let it drop. Okay. Other end of the table. And then see how I move my table around? That way I'm never close to it. Let it drop. And then I'm gonna come down here and I'm gonna move my table without putting my head over my table. Now there's my table ready to go. Okay. Now I'm gonna open my basin set. Same thing, I inspect it for integrity. I'm just gonna drop that in there. Now, I'm unsterile. I have not scrubbed yet. Okay, so I'm gonna take this and I'm gonna open it away from me first. If I can get the tape to come off. This tape really sticks to this package. I'm trying not to tear it, but it's tearing. And normally they don't tear like this, but you know. Also can't get a hold of it. Okay. So I'm gonna take it and I'm gonna pull this tab and I'm gonna open it away from me, or like this, just as long as I'm not over the field. And I'm just kind of looking where those corners are. And then I'm gonna pull this last corner to me, like that. Okay, so I'm just gonna let it go. My circulator can come over and tug it, but right now I'm unsterile, so it doesn't matter, so I can untug it. Now again, this is blue, that's sterile, this is sterile. I can move this over here without putting my face over it, okay? So now my table is open. Anything additional that I need to open, I can now flip on my table. So I'm just gonna grab something kind of small. Let's just say I want a Dermabond, because this is what we're gonna use to close the skin. So I'm gonna break this seal and flip it on my table. Like that, okay? Now you can flip it like this, but I know that Dermabond's gonna roll. So I was just like, bloop, but I wasn't over the table, okay? So let's say that that's all I'm gonna flip. Okay, this is gonna be my pan. So your pan is gonna come, they're gonna have these little locking mechanisms on them that show that they've been through SPD, right? So I look for those, I pop those, I'm gonna pop this top, I'm gonna take this and I'm gonna back away from it and flip it over. Okay, I'm gonna take these, I'm gonna inspect them for holes, and I'm like, oh, there's a hole. So it would be contaminated, I wouldn't use it, but we recycle.
Wait, so it wouldn't be a hole in it like that?
No,
Oh,
if you find a hole, you really wouldn't use it.
Oh, okay.
And then I'm like, okay, those are good.
That's
I'm
no.
gonna put that away in my case cart. And I'm gonna leave this here, because I can't touch the inside of this yet because I'm not sterile. So I'm gonna leave it to the side, okay? Now, I'm ready to open my gown and gloves.
Would you hold your gloves in your arm like this?
I could. I usually put them in my pocket,
Oh, okay.
but OR gloves don't have as many pockets. as these do, so.
Y'all always gonna be open on the mail stand?
It may be open on a mayo stand, I usually do it on a mayo stand, or you can open it on a prep table. You can open it.
Could a circulator do like the, I don't know what when they're holding it, but like,
And so, but then you could, but the problem with that is,
your glove?
where you gonna open it at? Cause then you're gonna, if you open it on the back table like that, then you've gotta open down off your back table, and that's bad practice. Cause I'm unsterile right now, so I have to open it so I can put scrub down and glove to use
Right,
it to
right,
set up
right,
my table.
right.
Nothing like doing this and all these people watching you. Alright, so now I'm ready to scrub. So I'm gonna do my scrub. You guys know how to do this.
You don't gotta do the scrubbing, man. You don't gotta do the full scrubbing,
This is how you do it.
You want the camera on you?
You might need to turn it.
Oh, okay.
man.
So this way you can see the whole process. There's no question about it. Mine probably won't be 5 minutes.
Oh, it won't be.
Thank you.
That's how we really want to put them on and start working.
I'm just doing a quick version of it. Yes.
You are aware she's recording, right? And teaching. This will be your check off next month. You're also gonna have a quiz on this, everything she has said. Maybe even stuff you see her doing. We've been known to do that.
Nah,
Almost contaminated.
see how he tried to trick me?
My bad.
Is that payback? So now I'm sterile, I can touch my table. Okay, sterile to sterile to sterile. Can't touch that, it's not sterile. Now you try to move things once, right? So these things I know I'm gonna have to reinforce my table, so I'm gonna put those there. Put that there so it doesn't get lost. I'm gonna orient my mayo stand to where I can use it to dress my mayo. Right hand, left hand. Put your hands in here, you feel for the inside. Now you see how I kinda make this opening? 1 foot. I put my body up against it so this doesn't drop, because if this drops, it's contaminated, yes or no? 1 foot. Now, they're all together. I'm gonna reinforce my back table.
Never mouse, you will have 25 minutes to do this.
Never moving it back and forth, because I don't wanna bring sterile to unsterile.
I know.
Now, I'm not gonna stick this to my table, but this is like a trash bag. Sticks to the side of your table, so I'm gonna lay it there. And I'm like, okay, the first thing I wanna do is, I'm like, oh, you know what, circulator, I have no towels. Can I have some towels, please?
There you go.
So here's how we do an envelope item. She's
While
gonna
I'm
open
holding
this.
it around, I'm putting it in my hand. Putting it in my hand. I'm gonna put that in my hand.
Now, she can
You
flip them,
cannot see my hand, so
or
she can grab
I
them,
can just take them.
or I can just sit them down.
Yep, because her hand's fully protected. Now, I know that I wanna move these once if possible, so I kinda always stack mine near where I'm gonna put my instruments, and I need 2 for the mayo. So I'm gonna take 1, I'm gonna open it up, and I'm gonna tuck here, and I like mine nice and tucked. And look, I can just move the mayo. Cause it's my mayo. I own it now. Now, this neat and tucked, I'm gonna tuck this in, cause that way an instrument ain't gonna pull it up. Now it's good to go. Now that I'm sterile and this is my sterile field, I don't walk between here, because then if I do, and I'm gonna turn my back to one of these, okay? If I needed to go to that side of the table, I would protect my hands and go to that side of the table. But more often than not, that table, there's an imaginary wall right there, 12 to 18 inches, okay? So I'm gonna go ahead and get my instruments next. When I come to my instrument pan, I'm gonna walk up and I'm gonna go look for the chemical indicator that's in here. I'll be like, ew, I don't see it. I'm gonna pretend I see it. I see the chemical indicator. Hold,
I
please.
thought they each have one.
Well, it could be buried under this count sheet. Oh, I see it. I see it. We're good. So then I'm gonna reach in my pan and get these without touching the outside of the pan. So I'm just gonna reach in here. I'm gonna grab these handles. I'm gonna pick it up and I'm gonna hold it right here while my nurse inspects it to make sure it's good. Cause then I only have to change my gloves if it's dirty. Alright, instrument. Now, that's done. So then the next thing I would do, I would drape my ring stand, which we don't have to do. But I'm gonna think about what do I need on the field. So my suction, I'm gonna throw off. So I'm gonna put that up here. My Bobby, I'm gonna throw off. Bobby, scratch pad, Bobby tip. I'm gonna put my Bobby tip out. And I'm gonna do that because when I count, I have to count that as a sharp. So I'm gonna flip it around where it's sticking out. That's gonna be thrown off. Okay, so I'm thinking, okay, what are we doing? Because I need to establish my neutral zone. So I'm gonna be on that side of the patient. So my table is gonna be situated this way. The patient's gonna be here, so I'm gonna put my neutral zone here. So my trash bag would go there. We're gonna leave that there. Here's gonna be my neutral zone, right here. So I'm gonna take my sharps box. I'm gonna open it right there with my blades in it. And the rest of this, the purpose of this is to touch once, okay? So here's my basins. Here's my Ratex. There's my kidney basin if I need it. My Asepto for fluids. It'll flop out. Here's another disposable bag. I'm thinking of things that I need to count. There's my peanuts. We're gonna put that there. And then if I had any suture or anything, here's my labels. We'll pretend half of this ain't in here. Now they're blank. So now I'm ready to go. I've got everything kind of set where I want it, because when I count, I've got my sharps here in my neutral zone. I've got my Ratex that I'm gonna use for dissection, blotting, soaking up blood. I've got my labels to label. And this is Dermabond, so that's a dressing. I'm gonna put it later. If I were to have dressings like, you know, we have the 4x4s and the Ratex and they look similar, I can put them here and cover them with a towel. That way I know they're out of my field of range. I will never mistakenly count those as Ratex because I've got them covered. Okay, so you'll see people do that. This little specimen cup or med cup, I can put right here on the edge of my table, because when my nurse comes over to give me lidocaine with epi or whatever we're using, bupivacaine, xylocaine, whatever we're using for that local anesthetic, she's gonna come over, she's gonna say, this is what I've got, this is the expiration, I verify it, I make my label, she squirts it in here, I put it on my label cup, I draw it up in a syringe, I put it, a label on that. And then it's gonna go, I'm gonna put my hypo on, it's gonna go up here in my sharp zone, okay? Then I'll start setting up my instrumentation. Not gonna get quite to that yet because we're not there yet. But this is kind of the basis of how I would set up. Okay, now if I was gonna be on the opposite side of the surgeon, I'd move my neutral zone here. It all depends on, because this is gonna be my working area. My patient's here, my Mayo's over the patient, I've got my table here. So then I can retract here, but I can go ahead and pick up a suture here to hand it to him. Or pick up something off my field to hand to him. Or something off my table.
And where's the surgeon standing?
This is if the surgeon's across from me. Even if he's beside me, and this is my working zone, then he's right here beside me, he or she, I can still help them and grab things off my table at the same time. And use both hands. Make sense?
Yes.
More clear?
Yes.
Okay. More clear on the sterile to sterile, sterile to unsterile.
Yes.
Okay. Alright, so see, then from there, my field's set up. All I've gotta do is set up my instrumentation, and I'm ready to count. Then I can tell my circulator, hey Jen, I'm ready to count now. And then she would come over and count. We would do our first count, make sure everything's good. She'd mark it on our whiteboard. How many Ratex, how many sharps, how many sponges, all that kind of stuff. We do an instrument count sheet. Once I know this tray is good, I could pass this off to her. Or if this was her desk over here, I could just come drop it on her desk for her. Then that way, even if she's not in here for a second, I can keep setting up. When she comes back, she can grab the count sheet, we can count. Okay?
Now, is this your preference? Like, Could you have your like stuff up?
Yeah, it's
stuff
your
up- up-
preference. Yep, it's your working field, it's your preference, you can obviously swap that, it's totally up to you. You typically want, normally I would probably put this over here, and the reason I would is because if I'm over here doing something and I need fluids, I can reach up and get that.
That's what I was.
Yeah. Anything you want close to you, you're gonna put on this side. Probably what I would put over here is like extra drapes, extra gown, things like that. You're also gonna have in here your surgeon's gown and gloves, cause you will gown and glove them once you're sterile. Now, I don't have to worry about where I'm putting my hands, because my table's sterile and I'm sterile, and I can put them here and I ain't gotta worry about contaminating. Okay? I can stand like this, I can stand like this, and I'm ready to go. Standing like this is not sterile. I'm out of my sterile boundaries, okay? We're not doing this either. We're right here. Right here, okay? Questions? Yes?
Yes, are you gonna make this a requirement, to basically like double drape your back table?
We do double
You do
drape.
do-
Mhm.
Oh, okay.
We look for that. I know, I didn't get taught that way either. It's okay. I had to learn too, you can.
Okay.
I didn't ever double drape mine either.
And I got
I didn't even see you do it and I realized that you had it on there.
Yeah.
Like, what heck?
the
Is
4x4s
that
in the book. Is that what they're talking about when they reference don't open those until the end of the case?
We just.
Okay, I just
Yeah,
wanted
you
to-
can leave those in your
So
PRNs
or
as
you
needed
want
in your
under-
bucket.
on the table and you won't have to
Just wanted to
do
make
it.
sure.
Yep,
But she's the one that makes the comment of precaution, like go ahead and do it.
yep.
So it
I
makes
feel like
sense
it
that
may
you do it.
be the acuity of the case too.
I think it depends on the case, but it also depends on the facility. Some facilities prefer you do it and some don't. Because honestly, I mean, this was the way I thought about it. I'm like, oh, that's money. That's money. That's extra money I'm putting on the table right here by putting this. But it is an extra precaution for you. When you get to the field as a tech, your facility may not care one way or the other. I also feel like too, not that it's not Jenny and I's generation, cause we're still very, very young, but a lot of the older generation techs double draped. Yeah. Cause a lot of the ones that I did, that I worked with, double draped and they had been in the field for 20 plus years, so they double draped, but we never did. You might see sometimes people, instead of double draping like a whole drape, they'll use towels and do like half their table, you know, or whatever. And that's the whole preface for this here. It's kind of an extra precaution for your knife blades because they're already here loaded. When you count, it's softs. These are considered softs. Sharps, which is your blades, sutures, hypodermic needles, Bovie tip is a sharp. Disposables, yank hour, people count pins sometimes. I don't, but basically if you count and leave it in a body, it's counted, or somebody has left it in a body and now we have to count it. I didn't count a pin when I was there. But, you know, you never know.
Don't they draw on the skin with those things?
Mhm.
So they.
Softs, sharps, disposables, instruments. Okay, we'll get more into instrument counting, towards the end of the mod. We do a first count in 78, so you'll do this whole setup right here. You'll get your stringer out and ready. You don't even have to take them off because you're only doing, oh, we are all kinds of good. Because you're only doing the initial count. So you can lay them here like this and lay out your retractors and then just start counting. 1, 2, 3, 4, hemostat. 1, 2, 3, 4, Kelly. 1, 2, tonsil. 1, 2, right angle, so on and so forth. You don't even have to take them off the stringer because you're just doing that first initial count. Now, with your counting, you're gonna be like this. You're gonna be like 1, 2, 3, 4, hemostat. Because you're still learning these instruments. I do not expect in the next 4 weeks that you to count as efficiently as we count. We've been doing this for a minute. We do give grace. You're still learning these instruments. But the point in you learning these instruments and me making those videos for you is you can look at the tip of this and say, this is a hemostat, this is a Kelly, this is a tonsil, this is a right angle, this is a Coker, Alice, Babcock, okay? You will also, the more you do this, you'll learn the order of these instruments. So, okay? Questions, concerns, comments?
This helps.
Nothing from the peanut gallery
Help connect the dots?
Yes, yeah.
for everybody?
Mhm.
Okay, perfect, all right. So then, the case is over, okay? Per AST, this is not Nancy's rule, this is not Jenny's rule. The AST rule is you restring these and put them in your pan and they go to SPD.
In order?
Never,
Oh, I was looking.
never have I ever